Welcome to Medicine Handy Point. Today we will discuss Mpox, which is the new name for monkeypox disease. So let's start. Now, in the media, suddenly a news started to pop up that Mpox cases has increased to 17,500 since January 2022, as opposed to 15,000 in 2023. So the news started to circulate in the media, and the media started to report the Mpox cases, and usually these cases started to appear in Democratic Republic of Congo, where 15,000 cases has been reported in since January 2024, and there have been reported 500 deaths only in Congo so far. Then the news started to appear in the media that Mpox has spread to Sweden and India, Sweden and Pakistan, and another pandemic is in making. So again, WHO declared Mpox emergency. WHO declared Mpox emergency in 2022 as well, but at that time the disease was not very lethal and not easily transmissible. This time is being a different strain, clade 1 strain, and is more lethal and easily transmissible. So Dr. Tedros, who is the director of WHO, he declared Mpox as global emergency of international concern on 14 August in Geneva 2024. Let's discuss what is Mpox. Mpox is actually viral illness caused by the monkeypox virus. There are two types of Mpox virus, clade 1 and clade 2. Clade 1 is the current emergency, while clade 2 was responsible for the emergency in 2022. Now, let's briefly discuss the background of the disease. Mpox was first detected in a monkey in 1958 in Denmark. First human case of Mpox was detected in 1970 in Congo, called Zaire at that time. Since then, this disease has been lingering on. But this is wrongly written. In 2022, some 70,000 cases were reported mostly in Africa, and then at that time the WHO declared it as a global emergency of international concern for the first time. So this slide is worth reading. Usually the transmission is rodents and monkeys are the reservoir for the disease, for the virus, while human-to-human transmission occur through direct contact with this infectious lesion of the skin, mucous membrane, or body fluid from these lesions, and this includes face-to-face, skin-to-skin, mouth-to-mouth, and mouth-to-skin contact, and through respiratory droplet as well. So let's briefly go through this symptoms of monkeypox. The monkeypox symptoms initially are flu-like, feeling exhausted, chills, fever. Then there will maybe headache, muscle aches, swollen lymph nodes with that sore throat, cough, stuffy nose. These are the symptoms. Then after some time, there will be erythematous lesion on the skin, just like can be seen here, that will bubble up and form a nodular lesion full of virus, and they will be very painful. Ultimately, crust will form and the healing will occur. So incubation period of the disease is 5 to 21 days. In incubation period, there will be no symptoms. Febrile stage lasts for 1 to 4 days. There will be fewer chills, headache, and lymph node enlargement. Rage stage lasts for 2 to 4 weeks, and there will be rash on the skin at that time. Recovery takes days to weeks, and then there will be no symptoms during the recovery stage. This is the disease progression. This is how the lesion will look like in Mpox. So you look at the face of this patient full of the lesions. How to diagnose it? So we will do PCR of the skin lesion. Crust can also be sent for pre-PCR. Vesicular fluid can also be sent for PCR. So we'll do PCR. If positive, we have to report it to public health. If negative, rule out the disease. What is the management? So isolation of the patient for 21 days should be done. Symptomatic treatment like analgesic for pain and antipyretic for fever should be given. Antiviral therapy, cidofovir, is being used in severe disease. We are waiting for the recent guidelines regarding that. Infection control and prevention strategy should be applied. We'll discuss that in the coming slides. Contact tracing and public health reporting should be done to prevent the spread of the disease. So outcome of the disease, most of the cases resolved, but there is a mortality between 1 to 10%. The 10% is usually in the children. Prevention and control of disease. How we control the disease. Let's first define a case of Mpox. Suspected case is any patient having typical sign and symptom of the Mpox is a suspected case. Probable case is if the suspected case has a contact with the confirmed case, that is called a probable case. And if the any patient has a PCR positive, then that is a confirmed case. So what we'll do, we'll trace the contact of these three type of cases and vaccinate them. That's how we can prevent and control the disease. This is the sample collection. Mucosal lesion can be collected for PCR. The crust of the skin lesion can be sent for the PCR as well. Is vaccine available? Yes, there are 3 vaccine available. These are the vaccine MVAB, and this is the recommended WHO vaccine against the Mpox. This is Bavarian Nordic, which is a vaccine producing company in Denmark, which produces the recommended vaccine for the Mpox. This is the visual of the Bavarian Nordic company, which is in the Denmark. Prevention or control strategy. So if any patient with a suspected or probable case should be referred to designated hospital in the country, where sample should be collected from the skin lesion and sent to designated lab in that country. Patient should be isolated for that time. Currently, screening counter has been established at the airport and border crossing in most of the countries. So hope we don't see these visual again. That's what we saw in COVID 2020 and 19 and 21. I hope we get rid of this disease soon. And thank you. And please subscribe to the channel.